Welcome to my channel, One Race, Human Race, all human. Everyone has a right to life, liberty, and pursuit of happiness. Everyone, not just in America, but the entire world. This is a perfect example of why we need Medicare for all, healthcare for all, universal healthcare, which the majority of the world has already. In addition, we need to follow the rest of the world and have survival checks, stimulus checks, regular checks, or at least $2,000 per person in America, like other countries have been doing for months and months and months.
Christmas is exactly 1 week away, and public health officials are warning people to stay at home this year. But just like Thanksgiving, many are ignoring these warnings and instead turning to COVID testing in hopes of lowering the risk of gatherings for the holidays. But as we've talked about a lot on this show, our testing system in this country is terrible. So our investigative and consumer correspondent, Vicky Nguyen, and a team of producers spread out across the country went to see just how hard it is to get a coronavirus test and the results.
Long lines and waits that can take hours.
I stayed in line for about an hour and 20 minutes.
As millions of Americans flock to get COVID-19 tests, now a new surge in testing demand with Christmas just days away. Despite warnings not to travel,
people are going to do it regardless. And so if you do, let's be as safe as we can.
Dr. Rahul Kara, an emergency room doctor, owns urgent care clinics and testing centers in the Chicago area. He says getting a COVID test before seeing loved ones doesn't guarantee safety, but it can lessen your risk of spreading the virus.
People think if I get a negative test, it's a free pass. I can go, I can hang out, I don't have to wear a mask, I don't have to socially distance. What do you say to that?
Having a negative test, any negative test, is not a free pass. It just tells you that at that moment, they did not find any virus in your nasopharynx or your nasal cavity. But it's important to know that as long as you are negative, please wear your mask, please socially distance.
Currently headed out to go get a COVID test, so let's see how long the lines are, how long the wait will be.
NBC News producers all over the country, from California to Florida, headed out to see what it's like to get a test.
Today it is a very long line.
In New Jersey, so far, it's easy at this urgent care clinic.
No wait, no appointment, just come on in.
In Southwest Florida, the lines are a bit longer at this state-run testing site.
Usually there's a line of cars all the way onto the street. Not today, but there's still about a half-hour wait.
But across the country, at another public health testing site in Los Angeles,
This is the line to get into the COVID test site. It's all the way under the freeway.
and in Dallas, at this urgent care clinic, be prepared to wait a while.
It's a minimum of 3 hours right now.
Despite long wait times in almost every region we checked, results were available within minutes, but they came with a hefty price tag. These private testing centers often charge hundreds of dollars. At this testing center in Florida,
Really no wait, 3 to 4 hours to get your results, but it costs $125 out of pocket.
our same producer found even pricier tests in New York City.
Today I had an appointment. It took just 8 minutes. But you have to be willing to shell out some money. This appointment costs $250.
Healthcare experts say if you have insurance, all COVID tests, rapid or PCR, are covered, and there should never be any out-of-pocket costs. But if you go to a lab or clinic that's out of network, like the ones where we got quick results, or if you don't have insurance, you could pay hundreds of dollars for one test. An insurance industry trade group found that 1 in 6 out-of-network COVID tests cost in excess of $400.
And that's why it's so important.
To learn more about having universal health care, Medicare for all, please go to the Rational National channel with David Dole, the Rational National channel, and look at any of his videos that will explain Medicare for all and the advantages of having it.
Important to check with your health insurance provider, make sure where you're getting tested is part of your insurance network.
To avoid getting a surprise bill before getting the test, check with your insurance to verify the doctor, lab, or...
In America, we have employer-sponsored health care, which means as long as you have you're employed, you have health care. What's needed is everyone to have health care provided by the government, okay? Now, it took a long time to even get past Medicare. Take a look at President Kennedy's speech he gave at Madison Square Garden on May 20th, 1962. He tried to pass Medicare for all. It didn't pass until until October 1965, when President Truman was the first person to get his Medicare. President Johnson had him sign, and it's a funny part where he asked him for an ID too. But my point is that we've been trying to get Medicare for All passed for a long, long time in America.
Clinic are in network. If you don't have insurance, look for a public health testing site. The lines may be longer, but the tests are always free. While experts say staying home is safest, if you choose to travel, try to quarantine as long as you can before the visit and for at least 5 days once you return, and consider.
Please stay home. There is a health crisis going on in America. Please stay home. It's so important.
You're getting another test. Tips to reduce your COVID risk while trying to get home for the holidays. Vicki Nguyen, NBC News.
Such important reporting. We could have solved this. Basically, the testing we have today is the same testing we had 9 months ago. And remember, it is all about information and isolation. If you think you have been exposed or if you have symptoms, we should be able to test and isolate. And if we are isolating, think about what it's like for the people who have hourly wage jobs. They simply can't afford to do it. For more on this topic, join this week's episode of my podcast, Modern Rules, where I am joined by Dr. Ashish Jha, Dean of Brown University School of Public Health. We talk about the failed testing system in this country and how much things could have been different. Our schools, our businesses, everything could have been open if we solved this, but it's not too late. Testing, tracing has got to be fixed in this country, even when we get the vaccine. Coming up next, with Congress racing to...
Why is it messed up? Well, back in January 2020, right? The Trump administration knew about it and didn't do anything about it. And then you have the interview with President Trump on February 7th, 2020 with Bob Woodward talking about, don't worry about everything. Well, President-elect Biden must remind the American public that it happened underneath Trump administration's watch. And because later on, they're going to blame President Biden for all this, all right? So you have to remind everybody that from the very beginning, it was mishandled. And you're doing the best you can to try to fix a problem that was mishandled from the very, very beginning.
As a relief bill, finally, restaurants are still not going to get the help they need. Millions and millions of employees, millions of workers who, by the way, many of whom don't have college educations. There's not other industries dying to hire them all. I'll be speaking with
Again, we need survival checks to all of Americans to help them survive during this period of time and beyond. Also, when you have Medicare for all, guess what? You'll have more entrepreneurship. We'll have more businesses because anyone can start a business even easier. Why? Because the government will be paying for your health care. Just like the government pays for the veterans' health care, the VA hospital, that's government-sponsored health care. Just expand that to everyone in America. And if you want to keep your employer-sponsored health care, you can keep it.
Has lost 6 businesses in the last year about what he needs to survive. Gates Jolman joins us next.